My name's Hien. I'm a radiation oncologist here at the Royal Adelaide. So proton therapy involves the use of a really specialised machine. There's a lot of technology involved, and essentially it relies on the physical properties of protons. So proton therapy is a form of radiation treatment that allows us to be more precise to the tumour target. At the same time, we can potentially reduce the amount of radiation that is being exposed to normal tissues and hopefully reduce some of the side effects that are associated with the treatment. Part of our challenge is to determine which patient groups are going to most benefit from that treatment. There are some patients where we can say that there's an advantage to using proton therapy, for example in paediatric patients or children who are suffering from cancer. Other cases would be brain cancer patients or patients with skull-based tumours. For those cases, we think that there would be an advantage. For other cases, I think there's a lot of research that needs to be done to try and work out which other patient groups would benefit from proton therapy. So for certain types of tumours, we know that you need to deliver a certain amount of radiation for it to be effective. For some patients though, using conventional radiotherapy, it's just not possible because of the other organs that are nearby. For protons, because it's more precise, it has a greater ability of delivering the amount of radiation that's really necessary to get the outcome that you're striving to achieve. There's no clinical facility in the Southern Hemisphere that's treating patients 12 months of the year. So in 3 years' time, here in Adelaide, we'll have the first facility that can fit that bill. And we're really, really blessed to be able to not only deliver that treatment, but also to have the team that's capable of delivering that type of treatment as well. One of the goals of the facility is to not just have a facility that can treat the patients that need this treatment, but also to have the research infrastructure in place as well, so that we can realise the full potential of the funding that we've been lucky enough to receive. Proton therapy has actually been around for a number of decades, but because it's so cost prohibitive, the proliferation of centres worldwide has been really slow. We're talking about machines that used to cost more than $200 million US. But because the price has come down significantly, we're seeing more centres popping up worldwide, and we're in a position here in Adelaide to establish Australia's first facility. There are certain types of cancers that will clearly benefit from proton therapy. Some patients, like the paediatric cohort, for example, we know that their bodies are continuing to develop, and radiation, unfortunately, can cause some detriment or harms to that patient's development. Proton therapy has the potential ability to reduce some of those harms, and there's, I guess, a greater probability or likelihood that that patient will go on to survive, and not only survive but thrive in society as well. So comparative planning is where we design a treatment plan using conventional radiation treatment, and we also design a proton therapy plan, and we compare the two to see whether there is an advantage to proton therapy. If we do determine that there is a significant advantage to proton therapy, the patient could be referred to a centre overseas, and if we can prove significant advantage, the federal government will actually support that patient's treatment. So for the patients that I've been involved with, I've had patients come back from their treatment overseas, and the treatment outcomes have been exactly what we thought they would be. Their scans have shown that the disease is controlled, and that the side effects that they've developed have been minimal and predictable. So our comparative planning program started back in 2015 through a research program that we started here. What that involved was getting certain software infrastructure first, and then developing a training program so that our staff, including radiation therapists, radiation medical physicists and radiation oncologists, could learn and develop their skills in this area. And we've been lucky enough for the Department of Health to recognise that work. And what they've asked now is that if a patient in Australia is going to be considered for proton therapy, that their case be referred to our centre for something called a comparative plan. So that's where we design a conventional radiation treatment plan and a proton therapy plan, and we compare the two to see if there's any significant differences between the two different treatment modalities. Through that work, we've successfully had about 20 patients go overseas for treatment to places like the US and in Europe. We've seen patients return from their treatment with exceptional outcomes. There are some patients who have gone down the conventional treatment route, and it's possible that their outcomes could have been improved with proton therapy. A really important aspect of proton therapy is making sure that the patient's in a really accurate position each day. A lot of that has traditionally been reliant on X-rays that are performed at the time of the treatment. What's going to be really important is that we develop some treatment protocols for each different type of cancer. Some of that protocol development will happen through some of the relationships that we've got with the centres overseas. Not only will we be learning about these protocols, but we'll help the other centres develop them as well. The work that we're doing here at the RAH, in conjunction with the relationships that we've got with the international centres, is really going to help us to deliver world-class treatment that patients from this region are going to benefit from.